Today, we are delighted to have with us Dr. Vince Bufalino, cardiologist with Advocate Medical Group and also Senior Vice President of Cardiovascular Services with Advocate Healthcare. What a mouthful. Welcome.
Thank you. Thank you for having me. Enjoy the conversation.
We're
Absolutely.
so excited to have you here today. Now, we received a lot of pre-questions before today's web chat, so I want to get to the number one question on our list. What are some of the latest treatments out there available now for treating the heart?
Well, there's lots of new things happening. It's always a moving target, but the new most exciting thing is actually percutaneous valve replacement, which is we put in a new valve without opening your chest. We can take a catheter and stick it in to the valve and be able to replace that valve just through a catheter. So that's going to be a new innovation, is really going to be a game changer, because we've had to previously do a full open heart surgery in order to repair these valves. Now we can do it just through a catheter. So that's a new innovation just released by the FDA in 2011.
Awesome. Another big question that we received, like when it comes to cholesterol, BMI, heart pressure, blood pressure, what numbers are important to know when it comes to keeping the heart healthy?
Well, there's lots of numbers. We're a very number-oriented area. So your cholesterol number, your BMI should be below 25. Your blood pressure should be below 140 over 90. But your cholesterol is a little more complicated. There's two areas. There's the total cholesterol, which is that big number we hear about, trying to keep it below 200. But it's the bad cholesterol that's the most important. It's LDL cholesterol. L, keep it low. The good cholesterol is HDL cholesterol. H, keep it high. So the LDL is the number we want to keep low, and as you have more risk factors, we try to make that number as low as possible, ideally below 100, and if you have heart disease, we'll try to keep it below 70.
Awesome. Dr. Bufalino, when it comes to genetics, is heart disease something you can inherit?
Oh, absolutely. There's lots of folks, Stephanie, that have inherited heart disease. If your father and your grandfather had heart attacks in their 40s, unfortunately, your risk of having a heart attack is clearly higher. So we look at that, and that's an important predictor. If you look at young people that develop early heart disease, typically they have a heart disease in their family. A genetic predisposition, they make too much cholesterol, and they develop blockages in the arteries, which is what leads to heart attacks.
So does it affect men, women differently, heart disease?
It does. You know, the interesting part, Stephanie, is that there are actually more women with heart disease than men. And in fact, more women die of heart disease every year than men. And, you know, when we ask audiences that, typically they'd say, no, it's breast cancer as the number one cause of death in women, and absolutely not the case. Actually, they did a survey that less than 10% of the women in the country knew that fact 10 years ago, and now about half of the country understands that heart disease is their number one concern. But heart disease in women is just different. They present with different symptoms. You know, typically chest pain is the marker that we tend to see in most adults who develop warning symptoms or have a heart attack. Where in women, many of them don't have chest pain. They'll have shortness of breath or profound fatigue. They get really exhausted doing things that previously they had no trouble doing. Now they get really tired doing something that was pretty simple for them. That's a marker, that's a warning that says we better go look at that gal and figure out what's wrong.
What's going on? Now that leads me directly into my next question, which is a question that always is out there when it comes to, you know, knowing the difference between muscle tightness, I'm feeling a little fatigued here, GERD, or chest pains. What's the difference between that and the real symptoms of a heart attack?
Well, you know, chest pains come in all kinds of shapes and sizes, you know, and so we have a whole list of things that are causes of chest pain, but there's only a couple serious ones. Heart attacks and blood clots to the lungs are sort of the 1-2 bad things. And then there's something called an aortic dissection where you actually tear the artery. Those are the bad things. But let's just talk about the heart for a moment, Steph. Heart pains come, they can be pressure, tightness, burning, squeezing across both sides of the chest, sometimes on the left, sometimes it goes down the left arm, up to the neck, up to the jaw, through to the back. All of those are typical descriptions. The interesting part of those is that typically they come with exertion. They come when you're doing something physical, going up the stairs, carrying a heavy package, rushing to do something around the house. Those are the warnings. Those are the symptoms that concern us the most, because they tell us that when we put the heart and make the heart exercise or exert, it's telling us by giving you some symptoms that something's changed. Now, some people just get shortness of breath.
Okay.
And that they just get winded easily.
Okay.
That's something that they were fine doing a month ago. Now all of a sudden they can't.
They can't do it. Okay.
Acid reflux, which is GERD,
Pretty common.
is a very common symptom. A little hard to tell because it's acid refluxing up into the esophagus, which is that main swallowing tube between your throat and your stomach. And when you irritate that, it gives you, it squeezes the esophagus so
Doesn't
you can
feel
get a
good.
tightness. Doesn't feel good.
No.
But it's usually related to something you ate.
Okay.
It's usually after you've had something that you shouldn't have, or one too many beers, or a little this or a little that, a couple extra Cokes, 3 cups of coffee. Those are things that will precipitate the acid reflux symptoms, whereas exercise symptoms are typically cardiac.
Okay, so one question that just came in. So what is tried and true? What are the symptoms of a heart attack? When do you know if you're a family member and you're witnessing it, or if you're the person experiencing the real thing? What symptoms should we look for?
Chest pain that comes at a time of a heart attack comes and stays.
Okay.
It doesn't come 30 seconds and go away and then come again in 30 seconds and go away.
Okay.
It is a persistent pain that's across the whole chest. They tend to be sweaty. They'll be a little bit breathy, they'll be a little short of breath. They'll not want to do anything. I mean, if you're having a heart attack, it's not subtle. You can look them in the face and say,
Something's
oh, wow,
wrong. Okay.
this person's sick. And that's a quick, and you know, this is where the concern is. People get worried about, I shouldn't call 911. I don't want to bother the paramedics. Absolutely wrong.
Call.
We want you to call. Call 911, come to the hospital, get checked. If there's nothing wrong, we're happy to send you home, pat you on the back and say, it wasn't your heart, good luck to you. On the other hand, it's important for us to have time. From the time of onset of your heart attack, we only have 90 minutes.
Wow, just 90?
In order to save the heart.
Okay.
So that 90 minutes is you got to get to the hospital, get into the laboratory, get us to put a balloon into that artery, open up that artery, and stop your heart attack. If we do it in 90 minutes, the truth is the amount of damage is minimal.
Okay.
And so we reduce the risk of death, you know, by a lot. So if I tell you a moment of a story, when I was training back in the 70s at Loyola, we were a big busy place doing lots of heart work, and if you came to the hospital with your heart attack, you'd spend 3 weeks in the hospital, you'd be disabled for 6 months or maybe the rest of your life.
Wow.
And we still lost about 18 to 20% of those folks to complications. So a pretty bad story. If you showed up today, Stephanie, and God forbid that happened to you, but if you showed up today, you would be in the lab, your artery open in 90 minutes, you'd be in the hospital 3 days, back to work in 2 weeks, and the death rate now is under 2% from close to 20. So
That's
we've had a
amazing.
tenfold reduction in deaths due to heart attacks. So it matters to get there on time.
And there's a lot on the horizon. We were just hearing a few weeks ago out in Cleveland that they're now even experimenting with stem cells to help grow damaged heart muscle. Tell us a little bit about that.
You know, stem cells are a new exciting area that we're just in the early stages of, but they are actually able to take stem cells, inject them into the heart, and be able to regenerate or regrow heart muscle. So a whole new way. So if we missed your chance and your heart's damaged, and there's not a lot we can do for those damaged hearts, now stem cells gives us this first new hope to be able to inject that into the heart and actually improve the heart muscle, have it grow, and have it start working again.
No, that's something that was never available before. If you
No,
had damaged it,
it's all, once it's damaged, you're damaged, and then you go to congestive heart failure, which is when when the heart gets weak and it doesn't work very well. You go to heart failure, and then you end up with a transplant or something of that nature, or frankly succumb to it, unfortunately.
Oh, wow. Now, if you're just joining us, we're chatting with Dr. Vince Bufalino, cardiologist with Advocate Medical Group and Senior Vice President of Cardiovascular Services for Advocate Healthcare. You can submit a question for Dr. Bufalino online right now. We also invite you to get to know your heart numbers today. Just visit advocatehealth.com/heart. Now, Dr. Bufalino, one of these big questions that we get often, and this one came in, we had quite a few people ask us, when it comes to research, it happens a lot. There's a lot of information out there. What is it that we need to be listening to? You hear the information about wine in moderation is good for you. Chocolate, dark, that is good for you. And so what should we be, then you hear sugar is just as bad for your heart as salt. What should we be taking in when you hear these studies that
It's hard, Stephanie. You know, there's lots of information out there. Unfortunately, we have being sort of bombarded at times by a lot of the things that are going on. I think the important thing is to understand that sometimes it's an initial study and it should be given some time to make sure that it's real. If it has reached the level of the American Heart Association, for example, if you can go to AmericanHeart.org, things that get to their website in terms of education are usually established things. And for them, the important things are salt, sugar, weight control, exercise, and of course knowing your numbers. What's your blood pressure? What's your cholesterol? What's your blood sugar? Those are simple things that can be done. The CDC has a big new national program. They call it the ABCs. And it's the Million Hearts campaign. What they're going to do is attempt to reduce 1 million heart attacks and strokes in the next 5 years.
How are they going to do that?
Well, they're going to do that by aiming at the ABCs. So A, aspirin.
Aspirin.
B, blood pressure. C, cholesterol.
And that's that baby little aspirin?
Baby aspirin. And S, smoking.
Smoking.
So those big 4 things. So for example, only 46% of the country that should be on aspirin is on aspirin. So we have a lot to improve.
Wow.
Only 43% of the United States has good blood pressure control. So we have absolutely lots to improve there. Only 33% of the country has good controlled cholesterol. And we know that although smoking is declining in the United States, we still have 40-some million people smoking. So we know there's a big problem there in terms of getting that to change. So the Center for Disease Control is basically said, we're going to try to get folks to follow the ABCs, and if we can improve that, and their goals are just to get it to 65%. If they can get every number to 65, they will save 1 million heart attacks and 1 million strokes in the next 5 years.
That would be absolutely amazing. And just down that same vein, we had a question come in from Daniel talking about the importance of how is it that you can determine whether or not, there's so many underlying conditions that can be out there, and just the simple checkup, sometimes it doesn't seem like everything can be caught, and you seeing the people that suffer from sudden cardiac arrest. So then what can you be looking for? What can you do proactively to make sure your heart is healthy, or are there tests that doctors can do to make sure early on?
Sure. Well, there's a couple things. One, we should be aware of ourselves, so we want you to know where you're personally at. And if you're in your 40s and have never really been checked, it's time. And we'd like to know the simple things. What's your blood pressure? What's your cholesterol? What's your blood sugar? Are those elevated? 2, do you have a family history of heart disease? Are there a number of people in your family that had an early heart attack, an early bypass, or an early stroke? So that's very important. And then do you have bad lifestyle things? Do you smoke? Are you overweight? Do you not exercise? Those are so we take all that together and say you're at low risk, medium risk, high risk, and then based on that, if you're in that medium to high risk group, we think those folks should be screened. We should look at them and say, well, if you're going to start an exercise program, Stephanie, and begin, well, let's get a stress test on you beforehand, because you have a number of risk factors, and we'd like to know that we can tell you it's safe, that it's okay for you to begin your exercise, and that's how we approach those folks. So the more risks you have, the more likely you are to have a problem, the more aggressive we should be.
But we've seen those stories where abnormalities may have been missed, when you were growing up. Is there anything a parent can do to make sure their child is checked young, before they get older, before they're playing sports or something and something deadly happens?
One of the programs we're involved in is doing EKG screening, and that EKG screening gives us a glimpse into those congenital problems, things that you could have been born with, abnormalities that you hear these terrible stories of a young basketball player who drops dead after a game, or a soccer player out on the field. So EKGs will be very helpful in actually screening out for causes of sudden cardiac arrest, and so that's an important thing for young people. Again, unfortunately, silent heart disease is still there, and there's a lot of folks that will develop blockages that we don't know about, and the tests are unfortunately not perfect. So having a high index of suspicion is very helpful.
So knowing yourself is extremely important. So then what type of exercise program, Christine just asked us on Facebook, what type of cardio exercise is taking it too far if you're just starting off, or just what do you recommend, just period?
Well, I always tell people you need to walk before you run here. It's kind of that simple. For the older folks, we get them to start with a walking program. Once they're cleared and it's safe for them to exercise, we can begin with a daily walking program, a simple 5 or 10 minute walk outside. Add to that a couple minutes each week and work your way up. The goal is to work out 30, 40 minutes. That's plenty, and that's where you begin. Now, if you're younger and you want to start more vigorously, well, then you can get some equipment, go to a class, get a tape, pick your poison. It doesn't matter what you pick, but we want you to do something that provides some exertion so that you get red in the face and a little sweaty. That's a definition of exercise, in that we want you to be able to go, wow, that was a workout today.
Okay.
Start simple, 10 or 15 minutes, and work your way up, each week setting some new goals.
So another question that we received, and it's a very good one. We often know that there are other conditions that you're suffering from, like diabetes and other things that can, if you don't check those, can have a trickle effect on other parts of your body. Does that include the heart?
Oh, absolutely. Diabetes is a big problem for us. The diabetic population is growing in the United States. Actually, they're predicting that a third of the country will have diabetes by 2050.
Wow.
So that's climbing along with the whole obesity epidemic. So we know that diabetes is a very critical predictor. And in fact, in women, if you take the two worst things to have, it's smoking cigarettes and diabetes seem to be the biggest predictors in women of early heart disease. So diabetes is incredibly important, getting screened early. And diabetes is, again, another lifestyle disease for many of these folks, changing their ability to control their weight by just reducing calories, and exercise is a simple thing that you can change your blood sugar.
Okay, so down that same vein, poor diet, what does it do to your heart? When you're eating just not in a way that's healthy, what damage can it do?
Well, those that live on that fast food diet, unfortunately, what it does is it contributes to all the problems. It raises your cholesterol, it raises your blood sugar, it raises your blood pressure. It makes you less conditioned because you're less likely to exercise. Because if you're eating poorly, you're not probably in a good exercise program. So all of those things kind of funnel down the road that if you eat poorly, you're going to end up with a problem. Now, is it perfect? No. We all know people that were crazy their whole lives and were fine. Yeah.
No, I didn't.
Yeah. But the truth is, the more likely than not, those with poor diets tend to likely develop some form of heart disease.
Okay, so what's the difference between good cholesterol and bad? Can you tell us what's the difference between those two? I had that question just come in.
Well, the cholesterol, as I said earlier, there's two kinds. There's LDL cholesterol, which is low density lipoprotein, and that's the one that is the predictor of artery disease.
Okay.
That's the one we want to keep low. HDL, high density lipoprotein, we want to keep it H high.
Okay.
And therefore, the more exercise you do, the more likely you are to raise your good cholesterol.
Okay.
And lower your bad cholesterol. So again, exercise plays an important role in cholesterol because it shifts them in the right directions. Now, we all produce cholesterol in our bodies. So you eat it, and it's also made in the liver. Okay. So what it's produced every day tells us that, in fact, if you're an overproducer, if you make too much all the time, even if you're eating zero cholesterol, you'll still have high cholesterol levels because the liver is producing. It's like a little factory, and it's making it on the conveyor belt, pushing it out.
Okay, that's interesting.
So in those folks, unfortunately, we need to treat those folks with medications because the medicines will lower the cholesterol, will slow down that liver from producing too much cholesterol.
So another interesting question that just came in on Facebook. We've heard of some pretty famous high-profile people that are living with some form of heart disease. Dick Cheney, former president, Bill Clinton. How is it that they're able to live with that? And if you don't do all of the preventative things up front, and then you go in and God forbid you have a diagnosis of heart failure, what is it that you can do? How is it that you help those individuals?
We spend a lot of time with people with known heart disease. Those are the folks that we aim a lot of our efforts at. After you've had a heart attack, we put everybody in cardiac rehabilitation, which is a several-month program where we do monitored exercise 3 times a week. So you're hooked up to an EKG and you work out in a controlled place with cardiac nurses available. That teaches people how to exercise, how to push themselves, how to go back to a normal lifestyle. Because once we've fixed them, once we've either bypassed them or put a stent in, we'd like to have them go back to at least the lifestyle they had before, if not a more active lifestyle. And that's an important thing because the more active we are, the more likely we'll help prevent future events. Now, once you develop heart failure, once you get to that bad place, Dick Cheney, for example, has advanced heart disease, number of heart attacks, and yet you look how active he is.
Right.
Now, he's had a number of devices and implantations to help support him, but he's still here and active and doing well. So there are lots of things today, honestly, Stephanie, 95% of the time, we can either fix it or control it. We just need a chance. And that's why we tell people, get in, get checked. It's very important because if you give us a chance to get to it early, we can make a difference in your life.
That is amazing. And one other question that we had about something that was recent that some physicians are recommending, not all, is when do you know you need to go in and actually have an MRI done?
MRIs, at least for the heart, are really not something that we're using very much of. Only if you have a known heart diagnosis do we end up with an MRI. MRIs are better for brain problems, spine problems, joint and orthopedic issues. We don't use them as much. We're learning. It's becoming better. It's helping us with some diseases, but most of the time, it doesn't add very much for us.
Okay, so Dr. Bufalino, if you were to give us a list of things that you were talking to me and I was a person and you wanted to keep my heart healthy, what would be some of the top 3 or 4 things that you would check off to say that this is what you absolutely need to be doing, whether it's with your getting the screening with your primary care physician? What are the things that you would recommend?
It's actually easy, Stephanie. It's eat better, exercise more. If you do those 2 things, you're way ahead of most of the folks. Now, of course, we think you should get checked. We should get you evaluated, make sure you know your numbers, and that particularly if you have heart problems in your family, you want to for sure be checked. But if you eat better, exercise more, that will go the longest way. And so whether you're 25 or 55 or 75, we put everybody into those programs because that's how they make a difference in their lives.
That sounds absolutely something that I'm going to follow, and I hope that the people that are watching will follow as well. Dr. Bufalino, you talked about some latest advancements in the treatment for caring for your heart. What are some of the things that you're doing in your practice?
Well, we're doing research all the time. As part of the Advocate Cardiovascular Institute, we're involved in cardiac research, so we have 45 different studies going on simultaneously. New drugs, new technology, new catheters, new pacemakers. We're testing all those to be able to begin saying, this is a better device, this is a better drug, this is a better approach. Because you want to continue to be able to understand that this is an evolving science. From when I began to today, we're doing almost nothing like we were doing 25, 30 years ago. And we will, in the next 10 or 15 years, be continuing to have newer advances that will change the way we deliver healthcare in this country, particularly around cardiovascular disease. We still, unfortunately, lose 900,000 people every year to heart attacks. 300,000 of them die at home or on the street. So we have lots of work to do to get to those folks early.
And what are some of the things that I know you mentioned just one initiative earlier about getting to those individuals and making sure. Any other things on the horizon that's happening on a national scale to try to
Well, on the
combat
national
heart
scale,
disease?
it's raising awareness. I mean, we all need to, these kinds of programs are good to be able to get that information out to folks to say, hey, I could be at risk. Why don't I get checked? It's that simple. And so the Heart Association spends an awful lot of their time making sure that the information is on the street, that it's accessible by the web, it's in several languages. It allows us to be able to bring patient education tools out there to get people's awareness raised and making people understand that this is no longer a disease of 30 years ago. This is something we can control. This is something we can typically fix. We just need a chance.
Wow. So there was one follow-up question to, you mentioned Young Hearts for Life. I know personally that was started by a dear friend of yours and colleague, Dr. Joseph Merrick, and the EKG testing that you're doing for young kids. Is that something that you can do for adults? Is that something that adults can ask for? Can you just walk into a practice and say, hey, I want to get my heart checked? What are the typical things that you do when you're paying attention and want to get started here?
You know what, the EKG by the time you're in your 40s is probably already past you in terms of being a really good screening tool. It picks up the early folks, those in their teens and 20s who might have an early problem. Although it still could be abnormal and show you some findings. But typically, in those circumstances, we tend to do a little more dynamic testing where we'll do stress testing, walk on the treadmill, monitor their heart, take some pictures, and be able to find out, do they have blockages or not? Do they have silent heart disease that we can get in there, find it, and repair it? That's what we typically do for adults. Because, but again, it's back at the simple ABCs. What's their blood pressure? What's their cholesterol? Do they smoke? If we can fix those things, we can actually make a huge difference.
That's amazing. So we're going to get ready to close here shortly, and I just want to reiterate for the audience there those top 4 or 5 things that we can start doing today when we leave. When this program is over and they're no longer watching. What are the top 4 things, 4 takeaways that you want people to leave here with?
Sure. 1, better nutrition,
Okay.
and just trying to have a balanced diet. And we don't need you to be perfect, but eat 3 reasonable meals a day. Big breakfast, small lunch, good dinner, and don't pick. That's part 1 on the nutrition side.
Okay.
Always a hard thing, but something that that we all believe in. 2, exercise. Start simple. Begin with a walking program and work your way up. Take yourself as high as you can, but be screened beforehand to make sure it's safe for you to exercise. 3rd, be checked. Make sure that you're seeing your doctor, checking your blood pressure, checking your blood tests, making sure that you're as healthy as you can be and you're ready to take on an exercise program. And then last is understand there are other people in your family. There are people around you all the time who you know are at risk, who you know are likely to develop a problem. They're smoking. Get those folks out there and say, hey, what are you doing? Why are you doing that to yourself? Encourage them to come and get in. Even though you're motivated, a chance to help your family, help the people around you by making sure you send that message out to them and saying, go get checked. This is your life. We want you around.
Dr. Bufalino, great pointers for us. Nutrition, exercise, get checked, look out for your loved ones. Thank you so much for joining us today. Really appreciate it. And that wraps up this edition of Advocate Live. Thanks for joining the conversation. Remember, you can text the word Advocate Live to 84444 to receive regular alerts about upcoming chats. Also, connect with us anytime on Facebook, YouTube, or at advocatehealth.com. We'll see you next time.